Good afternoon and welcome back. Happy Father's Day to everybody joining us here for our COVID briefing. We're joined by Chairman Mark Kern and Samantha Bierman on our question and answer segment. But before we get to that, Sam, you've got today's numbers.
I do. So as we have done in the past, the numbers that we are reporting to you first are for St. Clair County residents that have been tested. As of today, we are at 13,348 with 1,799 positive test results, which is an increase of 27 from yesterday. And that does include both males and females from their 20s to their 70s. We are at 11,537 negative test results with 12 results that are still pending. And unfortunately, we are adding an additional death today, which does bring our total to 132. And that was a man in his 70s who did have underlying health conditions. And as always, our sympathies go out to his family. For those who have completed the IDPH required 14-day quarantine period, we are at 1,335. For state totals, 1,360,784 have been tested, with 136,762 positive test results, which is an increase of 658 from yesterday. And for deaths, the state is reporting 6,647 today, which is an increase of 23. For hospitals in St. Clair County, we have 44 patients that are currently admitted due to COVID-related reasons, and 3 of those patients are on ventilators. For those congregate living facilities that are in outbreak status, and that does include 2 or more staff or residents that are either COVID positive or who have COVID-like symptoms, the Atrium of Belleville has 2 cases and no deaths. Berea of Belleville has 51 cases and 6 deaths. Berea of Cahokia currently has 25 cases and 2 deaths. Caritas Family Solutions in Belleville has 12 cases and no deaths. Caseyville Nursing and Rehab has 4 cases and no deaths. Cedarhurst of Shiloh has 13 cases and no deaths. Cedar Ridge of Lebanon has 71 cases and 8 deaths. Colonnade Senior Living in O'Fallon has 5 cases and no deaths. Four Fountains in Belleville has 104 cases and 27 deaths. Help at Home in Belleville has 2 cases and no deaths. Help at Home in O'Fallon has 5 cases and no deaths. Knollwood Retirement Center in Caseyville currently has 8 cases and 1 death. Lebanon Care Center in Lebanon has 55 cases and 10 deaths. Memorial Care Center in Belleville has 44 cases and 5 deaths. Mercy Rehab and Care Center in Swansea has 2 cases and no deaths. New Athens Home for the Aged currently has 57 cases and 7 deaths. St. Paul's in Belleville has 45 cases and 14 deaths. Swansea Rehab and Care Center has 29 cases and 5 deaths. And finally, TDL Incorporated in Belleville currently has 4 cases and no deaths. And I will turn it over to Chairman Kern for his zip code update.
Thank you, Sam. I would like to wish everyone a happy Father's Day out there, as Brian said, and certainly a special happy Father's Day to the father of this live feed, Herb Simmons, who's out there today watching us, and we look forward to Herb getting back here very quickly. So Team St. Clair counts on you every day. The zip code report for today, remember, if you don't hear your zip code, doesn't mean that you don't have a COVID positive in your zip code. What it means is that your zip code hasn't gotten above the level of 5 COVID positives yet. In 62059, we remain the same, again at 7. In 62201, we see an increase of 10 today to 72. 62203, we see an increase of 1 to 59. 62204, we see an increase of 1 to 61. 62205, we see an increase of 1 to 68. 62206, we see an increase of 2 to 155. 62207, we see an increase of 1 to 103. 62208, an increase of 2 to 94. In 62220, we remain the same today at 156. 62221 goes up by 1 to 151. 62223 remains the same at 66, as does 62226 remain the same at 193. In 62232, we go up by 1 today to 34. 62239 remains the same at 17. So does 62243 remain the same at 9. 62254 is also static at 82. 62255 is the same at 6. And 62257 is the same at 13. 62258 also the same at 17. And 62260 remains the same at 12. 62264 goes up by 2 today to 56. 62269 remains the same at 93, and 62285 is the same at 19. Brian, we got some questions today, don't we?
We did. Our typical Sunday question and answer segment is here, and we had some questions submitted overnight, so we'll get through these, get them all answered, and I'm sure there'll be other questions that come in, and then we'll get to those and get them their answers as well. It's always interesting to see what kind of questions come about of people that have been following. Some of them are things we talk about, but definitely need some refreshers. So, Sam, we'll start with some health department questions.
Okay.
The first one was, it seems like people who are getting COVID-19 aren't as sick as they were a few months ago. Is the virus weakening?
So as we continue to fight what, has started out as COVID, the doctors are finding out better ways to treat and what treatments are seeming to work better. And so while they are not necessarily, COVID is not getting weaker, our doctors are figuring out better and quicker ways to fight this virus. So people, aren't having to get worse before they get better. It seems like we've been just making strides, and we're hoping to continue to make those strides as we continue to fight COVID.
Okay. Another one that came in that says, since testing is accessible now, will each resident at all nursing homes in the county be tested? And by the way, I appreciate the daily updates and think this is a great community service. Thank you.
Oh, well, you're very welcome. And to answer your question, yes. So any long-term care facility or congregate living facility that does receive Medicare or Medicaid funding is required by Illinois Department of Public Health to have testing. So the steps that they would go through are they have to find a commercial private lab to be tested, and in finding those results, if there is an outbreak, then the health department would get involved and we would help continue testing, because there is a set of guidance that, once you have positive tests, how often you have to test your residents and your staff. And for any long-term care facilities that are out there that have any questions, please don't ever hesitate to give the health department a call. If you have any questions about the criteria to test or how often or any of the guidance from IDPH, we're always here to help.
Very good. And one more while we're here. We talked about earlier this end of last week, we announced that mobile testing will be beginning here in St. Clair County this week. I believe on Wednesday is our first day. The question came in, how long will it take to get the results from one of those mobile test sites?
So typically 3 to 5 days is what we go with. Sometimes it's a little sooner, which is great. It's just a bonus, but average 3 to 5 days.
Okay, very good. Chairman, a couple questions that have come in that you might be able to answer here. The first one says, if we move into phase 4 next week and your daily reports cease, how will we be updated?
So, we fully intend to make it into phase 4. At that point, a lot of what we do here is conversation, information about moving into the next phase and what that entails and how we continue to move in that direction. Once we get to phase 4, moving into phase 5 really depends largely upon the efforts of others. Is there going to be a vaccination? If there's a vaccination, that allows us to move past that phase. Is there a significant way to treat COVID, a cure almost for COVID? So since really those are things that are largely out of our hands, it may be that as we move in and when we move into phase 4, we may no longer do the visual daily briefings, but we certainly will always provide the information out there every day on COVID and the growth of COVID, or hopefully the decline in COVID in our area. If we would see a significant change and we think it would help for us to be here and answering questions and providing these live feeds, certainly we'll do that, and we will return to what we're doing now. As it is, we're here until we move into the next phase, and at that point, we'll have Mr. Simmons here, and we'll decide on the future of the live feed. But you can always be assured that you'll be able to get information and the pertinent information, the same significant facts it will be provided here every day on our EMA page.
Okay, thank you. The next one's titled Zip Code Confusion. And the person writes, is it good or bad if your zip code keeps rising almost daily, or is it considered relative to what's occurring? I know now the more that gets tested, the more the count goes up, but would we consider that good or bad?
Well, I think additional testing is always good. It is the way that we're going to control the spread of COVID. Finding out who may have COVID, a person that didn't realize they had it, a person who is spreading it and who is asymptomatic is always a positive thing. I think it's always a bad thing, of course, if someone does contract COVID in your zip code. That's not a good thing. It may not necessarily affect you because zip codes are rather large, but it certainly affects the people and that contract COVID and those around them, because this is a nefarious virus that it's not kind to those who contract it. So I think the question is one that we want to test, we want to find out. And in the end, that's the only positive way that we'll be able to solve this pandemic.
Well, I think one thing that's important to mention as we go through this, and it's a question we answer a lot on the page about specifically the zip codes where, they mention their zip code keeps going up. That is a cumulative number. Since the beginning of this pandemic, that number is cumulative. So we don't expect that number to go down. We expect that number, there are some days where you'll announce there was a change in an address or a patient that had moved, but normally we expect that number to increase and expect it to continue in that same manner. All right, thank you. We'll go to Sam for a couple more that came in here. The person writes, will taking supplements help prevent infection from COVID-19?
While taking supplements can certainly help keep you healthy, what we've said from the beginning, the best way to keep yourself COVID-free is to continue to eat a balanced diet, continue your social distancing, wearing your mask when out if you can't maintain 6 feet of distance between you and others, as well as hand washing. Those are what we've been saying from the beginning, and that's the best way to help keep your self safe from COVID.
Very good. Okay, the next one says, why do you keep putting out the same numbers? Or at least not putting out the recovered numbers and not showing those who've been released from quarantine either?
So we do put out those that have been released from quarantine, and today that was 1,335. The reason we don't do a recovered number is because depending on the person, recovered can mean quite a few things. Certain people could have a much longer period of recovery, and some people could have the bare minimum for what IDPH says is a recovery period. So it's too far from left to right to be able to say recovered. So that's why we use the number for those that have been released from quarantine.
Thank you. Next question says, is it true that you're not allowed to report how many cases of COVID are linked to protesting?
So during the contact tracing, if someone is positive and they've been exposed, if you get that phone call, you won't be told who exposed you. You will just simply find out that you were exposed to someone who is COVID positive. So when we get those numbers, we don't receive them with the information that they were at a protest or where they were. We simply get the information of those that we need to contact.
Well, and due to privacy laws and everything that exists, the only mandated reporting of any COVID outbreak is a congregate care facility,
That
correct?
is correct. Long-term care facilities and congregate living facilities are what we are mandated by the state to report. So you will be notified, you just won't be told the individual person that you were exposed to, just for confidentiality reasons.
Okay. And one last question for you, Sam, was, do nursing home numbers go in the zip code of the nursing home or the address of the patient? For example, if a patient lives in a nursing home in Belleville, but their legal mailing address is Freeburg, which zip code are they reported in?
They are reported for where they reside. So, and that's some of the detective work when we tell you that we process the numbers for results. we may get some information from a hospital that has the person's name and their address. Their address, as the question said, maybe they live in Freeburg, but the facility that they are staying at, long-term care facility, is in Belleville. We would have to find out with that facility and confirm, yes, this patient is staying there, and it is reported for the zip code where the patient is currently residing.
Got it. Thank you.
And Brian, real quick before we move on, we had a question that was submitted to the EMA page before we started today from a lady named Nancy Harmon. She had submitted a question to you guys. Nancy, if you would like to call me, we won't go over the question on the air, but if you want to call me at 825-4466, I know you had a pretty specific question. We're happy to help you, so please give us a call if there's anything that we can do for you.
Fantastic. Thank you. Chairman Kern, a couple that have come in as it revolves around Phase 4 and the modifications we expect to see this week on Friday. It says, when will inside dining be allowed at restaurants?
So if we move into Phase 4 on Friday, as we expect, then indoor dining will be allowed on Friday. We haven't received the specific guidance from IDPH yet. We expect them to come out with some rules and regulations as to how that will look. And in the initial look-see says that maybe 50% occupancy will be allowed in restaurants and establishments. So hopefully that is the part of the guidance that they'll give us, and that percentage will be what is allowed. But we won't know the specifics, but yes, indoor dining will be allowed as of this Friday if everything continues to go as planned.
Okay. Another question similar to that, and you pretty much answered it, but we'll say it here. It says, are restaurants allowed to have eating inside yet? When I went to get a carryout, I saw people eating inside a restaurant.
Well, starting this Friday, it will be legal to do that, and certainly it'll be the responsible thing then. As the rules are with it, I'm sure that there'll be regulations for the restaurants with mask wearing and separation of tables and those type of things.
This kind of follows up to the earlier question where we talked about if and when we will end the daily briefing. As you said, we're going to continue at least through this phase and then make a determination after that. The person writes, if there's a second round of this virus in the county, will we begin keeping citizens updated daily again?
Absolutely. The reason that this was started, and this is our 100th program today, was because of there was a great lack of information at the time. We all had significant questions. There was no real single source of information. We saw people getting their information from a lot of different sources, some very incorrect, and so we wanted to make sure that the general public knew that they could always go to one place at 3:30 in the afternoon or whenever they wanted to pull it up and find out the information. That's why Team St. Clair was put together, and so if the need arises and we see a spike, we see changes in this, we'll be back and we'll be talking about it. But as we've said, it'll always be here. It'll be here in a form where you'll see everything that we talk about every day. It's just we may not be there reading it to you or discussing the issues in depth.
Okay. We're joined by Susan Sarfati, the St. Clair County Regional Superintendent of Schools. And as we do weekly, we got a question in about schools. The person wrote, Susan, will students have the option to do e-learning in the fall, as I am not comfortable sending my child to school in person yet?
Well, it's early to make that decision. School districts are planning for 3 different options for school. In-person learning, something called hybrid learning. It's a combination of the two. And for remote learning, if we should have another flare-up. But the numbers just aren't solid yet. We don't know what it's going to look like when August comes. We are still expecting more definitive guidance from ISBE sometime this week.
Okay. Well, thank you for joining us each Sunday and answering those questions. And as soon as you receive guidance, we will see it as well and make sure that it's shared out there. As we'll gladly carry any message to the education population here in St. Clair County.
That sounds like a great plan.
Thanks, Susan. Thanks for being a part of Team St. Clair every week. We appreciate that.
Happy 100.
There we go.
Thank you very much. Just a few comments that came in as we did last week. People wrote in, didn't really have a question, but we'll read through their comments real quick. The first one says, I moved to the county 2 years ago, and I've been impressed as to the transparency of the local and county governments that they were providing. This page has been very helpful before and during the pandemic. I hope that once the threat of the virus is over, the page continues with the general information that we've become used to. Thank you, and we are praying for Mr. Simmons. He has provided our family assistance in the past year. Absolutely. The page will continue as it was before and through the pandemic and into after the pandemic. This is a place to provide information to the residents of St. Clair County. The next person wrote, while we appreciate all the Herculaneum efforts that you all put in, like today, you all need to start taking some days off. It's not as serious as it was in the beginning, and others can cover for a few days. If you need help, I'll gladly come assist. So, nice to hear that person right there. I don't want to sit here and say that it's not as serious. Until this virus is eradicated, it's going to be serious, and we are going to treat it as such. But as the chairman led information about earlier, we are looking at ways to continue this briefing in different manners to make sure that information is always brought to the residents of St. Clair County. And the last person wrote, thank you for the continuous updates. Happy 100th, and I appreciate hearing local information daily. And again, as the chairman announced, that's what this was put for, to have a local source of information that has been vetted and accurate, and we've done that for 100 days, and we're going to continue doing that here for the foreseeable future until a decision is made that we will stop these briefings, and then once that happens, we will provide you the information in another form. So rest assured that information will still be readily available to all the members of Team St. Clair. We thank you for following us. We thank you for joining us here on Father's Day to learn this information. Happy Father's Day to all the fathers that are watching. We'll be back shortly with Cindy and Daisy to translate this to our Spanish communities, and we'll be back with you tomorrow live at 3:30 with our next daily update. Thank you.